Okay, so what I'm going to do with our patient here is I'm going to apply the rebuilder machine to her right knee. So what we use is our special spray here, and these are special straps that are going to conduct the electro energy into her knee. So this is very easy how we apply these, very comfortable to the patient, and this is going to conduct the signal exactly how we want it. So we're just going to turn this on, give it to the patient to turn on their intensity on what they feel is comfortable. The patient's going to feel some kind of a pulsed muscular contraction. This is running at 7.83 hertz, the same frequency as the brain. So this is kind of acting like a brain to the nerves around and into the knee to kind of get them to work on that frequency again. So eventually the patient doesn't have to rely on something like this, and the brain can now communicate correctly with the joint and the surrounding nerves. They go into the soft tissues as well. How does that feel for you?
Feels pretty good.
Feels pretty good. And that's pretty much it for the rebuilder. Foot right up here on the table. Good. And on her, we're going to particularly adjust the head of the fibula. Go ahead and take a few steps, come back, see if that's any different. Just going to put some stress on it, walk around, see how it feels. Any difference with that?
That feels pretty good.
Feels pretty good there. Is it 100%?
I wouldn't say 100%.
So let's do another move here. So you may want to come a little bit closer here, focus here, and put all your weight. We're going to move tibia more anterior on the medial aspect. Good. Let's go walk on that, put some stress on it, see if it's any different.
That feels good.
100% good?
Yes.
Yeah, okay. So typically 1 or 2 moves, sometimes even a third move, helps reset the knee to track a little bit better, and patient can improve pretty quickly functionally and have a decrease in pain and symptoms. Okay, next we have our patient on our knee on track machine. This is going to help the knee distraction, knee decompression. You want to get this to where it's tight enough to where this is not going to slide, because this part is going to distract the knee distally, or the tibia distally away from the femur. Does that feel tight?
Nice and snug.
It is. Let's do a little bit. Is that good?
Yep.
Yeah. And then we're going to set the parameters on the machine, and it's going to start to distract. Just tell me if it's starting to slip at all.
No, it feels like it's on there pretty good.
Good. So it's going to be a protocol of roughly about 6 minutes, and it's going to decrease in the tension, come back about 25%, and just have an algorithm to go back and forth to slowly create some negative pressure in the knee, which is going to create more synovial fluid influx. Okay, patient's done with care, so we're going to go ahead and just release the straps using the 20,000 optical watt. Please don't look into the light. And these treatments run for about 30 seconds in each area. This is to decrease inflammation pretty much. It's going to help wake up some cells that are dormant, help them start becoming more metabolically active, and hopefully we get some good results from it immediately. Okay, so we're done with the LED therapy. We're pretty much all done. We just got to complete the rest of the spinal adjustments. Typically we do that with some patients we don't. On her, we always do that in every visit. So let's go ahead and stand, put your shoe on, and let's walk over to the treatment room again and see how that knee feels. How are we doing?
Feels good.
Feels pretty good. That concludes our knee therapy. So after your trial treatment, in about 24 to 48 hours, you're going to come back into the clinic, and we're going to see how everything went. If you had good positive results and you're a candidate for this care, then we're going to put together a treatment plan, and we'll go over everything that it consists with. Next, we're going to go over, well, how do we pay for this? Well, right here on our website, there's the usual cash check or charge that we can take. There's also a couple different financial institutions listed here that will also cover the tab of your care. And we also have some other solutions that are interest-free, some in-house financing, as well as some prepayment discount plans as well. So we look forward to going over all of that information with you and having you be established as a patient here and finally have pain-free knees. So we'd love to help you. We'll see you soon.